In this PACS video breakdown, we're going to cover the essential structures associated with the cervical spine. We'll see from C1 all the way through C7, and then we'll also get into a little bit of the thoracic spine at the inferior aspect of the image data set. So I think in the end, you'll be able to see how these structures all kind of come together, how they work, how they look from slice to slice based on the three anatomical orientations. So we have that axial image, we have the coronal image, and we have the sagittal image. So you'll kind of see where we're at. And I think, like I said, it'll bring things together as you can see how they kind of work together, and you can see those articulation points as they look in an actual scan. So let's get started. Just kind of looking at the anatomical structures here, we'll focus on the axial orientation first, so the upper left orientation. And just kind of looking at it as we go more and more inferior, you can start to see some of those structures that we've talked about in previous lectures and previous videos. And once we get down into the foramen magnum, for example, you know, all right, we're getting close to those areas of interest. So specifically, you can start to see now that aspect of the dens here. You can see that respectively see that anterior arch where that's at. And as we continue to go down now, you can see that posterior arch additionally. So really a great anatomical image based on the structures that we've kind of emphasized before, because you can see those arches and you can clearly delineate where that transverse foramina is and where it's at respectively on this side. Additionally, you can kind of see where the structures of the lateral masses are as well, transverse processes respectively. As we continue to kind of go more and more inferior, you'll be able to see some of those traditional characteristics of that cervical spine. So speaking of that, you can see those bifid spinous processes here. You can see those little tips. So just kind of look for the bifid spinous process, look for the transverse foramina, and that will kind of outline, hey, these are the key structures. So really a great image right there of the transverse foramina. You can see that the vertebral arteries would pass through those transverse foramina, while the spinal cord would be a part of that vertebral foramina. Just looking at some of the other structures that you know, I think this is a pretty good slice because it shows an aspect of the pedicle right there and right there before it transitions right now into the intervertebral foramina. So you can see that foramina would be actually located there and there respectively on both sides. So really a great transitional image there through the pedicles. Respectively, then you also can see the area of the lamina on both sides of the spinous process in between the regions of that transverse process. As we can kind of continue to go down, you can kind of look at the disc spaces there. You can see actually the nucleus pulposus quite well on that particular slice, so you can see some of that disc. And working our way more and more inferior, again, utilize those key unique aspects to be able to say, all right, this is definitely a cervical vertebra because of this feature. And you know what those features are. We've mentioned those features. You see them, they can clearly define those as we continue to work more and more inferior. So kind of continuing to go down, a lot of the structures that we mentioned before are visible. You can start to see again the intervertebral foramina starting to form here and here between those where the bony aspect of the pedicle would be on the slices, superior and inferior to those locations. You can see how the spinous process is becoming more and more elongated in this case. So it's transitioning and it's taking on the appearance of a thoracic spine as we continue to kind of go down. So what you're really seeing here is the vertebral prominence. As we continue to kind of transition down, you can now subsequently see that articulation with the rib. You can see that costotransverse joint here and here on both sides respectively, and then we can see the costovertebral joints respectively right there as the head of the rib is articulating here with the vertebral body. So I think really a great scan to be able to break down some of those classic anatomical structures. As we continue to go down, you can see those articulation points really, really well in the thoracic spine. You can see that costotransverse joint, the costovertebral joint respectively. We can see the body, and specifically actually you can see this particular slice shows more of an aspect of the intervertebral disc itself. You can see that well. Intervertebral foramina, nice and round, nice and symmetric, and then both transverse processes and that spinous process there as well. area of the lamina respectively there and there, area of the pedicle respectively there and there. So like I said, I think it's a really great scan to learn on because these anatomical features are very consistent with kind of how either renderings are done, like those anatomical renderings, those diagrams are made. So, you know, kind of like textbook based anatomy on this particular person. So really great images, I think. So to look at it and emphasize some other orientations, we can be able to see the coronal orientation. And, you know, throughout this, hopefully you're utilizing the guide to kind of help you with kind of set these images so you can kind of see where you're at respectively. But as we kind of go from front to back, and we know that the spine is posterior, you can start to see it actually coming into range right in there. Respectively, we can be able to tell very, very clearly where we're at. So you can be able to see C1 here, and then C2 here. So we can see the atlas, we can see the axis respectively. You know that clearly by the odontoid process there. So the areas of the lateral masses are very well demonstrated. Area of the zygapophyseal joint between C1 and C2 is demonstrated as well. So in terms of pure counting, let's just kind of go through that. So we know that C1, C2 is incredibly easy to identify because of the odontoid process, but then we can see here's, okay, C3, here's C4, here's C5, here's C6, and as we continue to kind of go down, that would make this C7, and that would make this T1, and looky there, all right, we have that rib coming in and articulating just as expected with that T1 vertebra. So you can see those articulation points there respectively as we continue to go more and more posterior for these images. And you can subsequently see other ribs kind of coming through on that posterior aspect there for those additional thoracic vertebrae that are being demonstrated here. You can see those spinous processes just sticking out. So as we go really posterior, you can see where those spinous processes are. And of course, we can also subsequently palpate those regions ourselves. So hopefully that kind of helps orient yourself a little bit. You can see the region of the spinal cord there as well. And just to kind of quickly go through things on the sagittal images, so you can kind of see where we're at, going from patient left over here through the midline and then transitioning into patient right and subsequently going back to about midline, because we can start to see some of those structures that we know. You can see those bodies very, very well. And like I said, kind of emphasized during the lecture, you can see where the odontoid process is, because you can see that fusion of bone here that's taking place. So this is definitely C2 with the odontoid process, which would make that the anterior arch and the posterior arch respectively. And you can start to see some of those spinous processes here of the cervical spine then respectively as well. While also visualizing, of course, the bodies, the intervertebral disc spaces accordingly. So in the end, you know, I want you to know those key characteristic structures that are associated with the spine. We could go through a lumbar spine, but really, you know, anatomically, the anatomy is very similar to what we're seeing. It's just when you look through that slice, essentially what you'll see is that you'll see a bunch of ribs, a bunch of ribs, a bunch of ribs, and then all of a sudden the ribs will disappear, which means that we're just at that transition point between cervical and lumbar respectively.